Thanks so much for joining me on the podcast. How are you today?
I'm good, thanks. Beautiful day outside, can't complain.
That is like the ideal scenario. We want the nice weather always, right?
Exactly.
Uh, it's your first time coming on the show. So, what I always like to do with guests that it's their first time being on the show is just give you a second to tell us a little bit about your background, your company, and then we'll go from there.
All right, sounds good. So I'm Leigh Burchell. I'm Vice President of Policy and Government Affairs for Altera Digital Health. Altera is one half of when Allscripts moved into two different companies. And so we are in the hospital space and kind of the larger physician practice space. And I've been with the company for a very long time, lots of different names and shapes and sizes and all of that. But I've been running the government affairs function since 2008 when President Obama was running. And it was kind of clear that health IT was going to become a really regulated big topic for policymakers. And so I kind of established the government affairs function, and the rest is history, I guess.
How has the role changed since you started at this company?
Oh, yeah, so different. So the reason that we established a government affairs function was that, it's pretty clear if Obama was elected that he was going to ask Congress to take action, which of course they did with the High Tech Act. And ONC already existed, but they didn't really do much. And, people didn't have to really worry that much about what ONC was doing. They weren't putting out regulations, anything like that. Of course, now we're in a totally different world. We are a highly regulated industry in terms of health IT. And it's not just ONC, ASTP, it's also CMS. But also, people now really value health data and they understand the tremendous power that sits in health data. And so the CDC is about us, FDA, even, DEA, Department of Homeland Security. People you wouldn't necessarily think of are paying some attention to health IT and putting out pronouncements about it or guidelines or regulations. And then the states actually in the last year, 2 years, 3 years have really been ramping up their activity as well. So lots and lots of people have a lot to say from a policy perspective about health IT, which, it can be challenging, but it certainly makes my life interesting. I constantly like absorbing all the new stuff and helping the company comply. So never boring.
What's obviously you've been in this space, you've been it's not easy to stay on top of all of this stuff because it changes so often. And there's always something, right? There's always some new update. How do you personally like to stay up to date on any changes happening? It could be changes, trends, just new piece of information. How do you like to stay on top of that?
Yeah, I think number one, I have a lot of email listservs and a lot of great contacts in the industry. I've been doing it for a long time. I'm really involved with the Electronic Health Record Association, and that's, generally people from our space. So there's 27 member companies. So we all share information with each other. Generally, we are aligned on what we're asking of policymakers. And so we all want to team up because it's more effective when more of us are making an ask than just one company. So that's a really, really great resource. Obviously, reading, obviously, relationships with policymakers and also with other entities, provider organizations. I know a lot of people who work, within the AMA or AHA or MGMA or whatnot. And that's also really helpful. I'll also say we have a great team at Altera who is working on this. And we're all kind of, hey, do you see this? Do you see this came out? Here's my take on it. And we all just are constantly sharing our analysis and what do we think it means to the company. It's really all you can do. I will say it can feel kind of overwhelming sometimes, particularly certain times the federal government just decides to put out like 5 things at one time, right? And so you're kind of scrambling to submit comments or process a new final regulation or read a action plan or something like that. And then the states, there's 50 of them plus territories. That's a lot to track as well. So it definitely can be very challenging, but it's what I get paid to do for sure.
You think sometimes we try, like, we hear this a lot about the US health care system in general, right? We tend to almost, for some parts of it, overcomplicate maybe what we're doing. Let's say you have full authority. You could do whatever you want tomorrow to impact this space. What would be I know you'd probably have a million things you'd want to do, but what would be one thing that you would be your top priority if you could control everything that you are staying on top of on the day to day?
Ooh, I mean, if I could only pick one, which is very hard, I would say I really wish the states would chill out on their individual approaches that they're coming out with on a lot of topics, right? Consent management, AI, interoperability, onshoring requirements for technology. All of that's a hassle. It's a lot harder for us to comply with 50 different states. I really would love to see good, intentional, thoughtful frameworks around AI at the federal level, around cybersecurity, privacy at the federal level. That would make our life a lot easier. Just if there were effective things coming out of DC, the states wouldn't be feeling like they have to take action. They're taking action in areas where they're not getting what they need out of Congress. And so they're saying, all right, we got to do it, right? If we could get them to just chill and DC to step up and do their job with, not burdensome, not like heavy regulation, let's just support innovation while making some guardrails, that would be awesome. It would simplify things immensely.
One of the things, there was a couple reasons I was excited to have you on. One was to ask you random questions like that just kind of pop into my head in the moment. And then I have a couple questions I just wanted to make sure I ask you. I'm going to pull them up I'm going to try something new. I have some kind of in a notepad on my phone to ask you.
Sounds good.
One of them is around, there's been a aggressive health IT deregulation, right? So, how do you see this trend reshaping certification programs, interoperability standards, and quality reporting over the next few years?
That's a big question. I think, first of all, heard messages of deregulation. There actually has not been a lot of deregulation yet, right? So we've had a few enforcement discretion actions announced where they say, here's a regulation that exists and you don't have to comply with it. You won't get in trouble if you don't. So we've seen a couple of those. Mostly it's messaging so far. It is interesting to see in the second Trump administration, the lead on health IT policy is really coming out of CMS. ASTPONC has not done a lot yet. They put out, a final HTI-4 rule, and they've done a little bit, but really it seems like leadership on this topic is coming from CMS. That's interesting, right? They actually don't have jurisdiction over health IT companies like Altera. They have jurisdiction over providers. And so they're putting out a lot of this stuff. There was a big pledge event. There's all of these things going on. But a lot of it's voluntary. And so, to your point in this kind of shift and how is this administration working differently, they're doing what we have seen from previous administrations, which is we don't want to have to regulate you. We would like for you to volunteer to make these leaps forward, to make these changes. And this is true of technologists, providers, payers, like the whole stakeholder group, app companies. So they've said, hey, let's volunteer and we'll see how it is. If it doesn't go well, we'll regulate. I mean, they're certainly not the first to do that. We've signed pledges before. And so we'll see how effective is that, right? I think all of us want to do the right thing. We're all interested in making the same movement. We're all patients, or we're all parents or children or siblings of patients as well. We all live the pain in the rear end, experience of navigating health data. So we all want this to get better. I think that the challenge is that tightrope of where are we going? What's the aspiration? But how do we do it in a reasonable, standards-based way so that Altera can exchange with Athena, can exchange with Epic, can exchange with Greenway, right? And we all can do that. If we lose that standards focus, we risk kind of falling off that balance beam of being able to exchange information. So we need some level of government work continuing, but I really like the idea of it becoming a little more focused on innovation, a little more focused on, here are the pain points, less about what does your product need to look like. The government does not make a good product manager. That's not their strength. So let's stick with, okay, some promulgation of standards, all of us, rowing our boats in the same direction, and then leave room for all that other kind of good stuff that our clients are asking of us.
And where do you see us going from here? Like, let's just kind of take a 12 to 18 month view, where do things continue to go through your lens from here? I know you gave us some great, thank you so much for answering that last question, by the way. I know that was a doozy. It was a long question, but like, where do you see us continue to go from here? And what still, I guess, concerns you moving forward that you'd like an update on, you'd like to see change?
Sure. Yeah. I mean, I think, you had asked about certification. I expect we will see changes to certification. There are statutory requirements that are in high tech, that are in 21st century cures, that ONCASTP has to comply with in their certification program. But they can shift things a lot. There are a lot of people talking about what are we doing with Fire? What are we doing with apps? And clearly there's so much more that we can be doing than what the industry is doing. So I think that's great. I would love to see them move away, as I said, from kind of the nitpicky, like little directive things as opposed to let's just get more interoperability progress happening. I think an interesting challenge is that what regulators want from health IT is not necessarily what the users want. So the people who buy the products from my company are hospitals and physician practices. What do they want from their product? They want usable, they want helpful information at the right time when they're seeing patients, and they want to be able to get or share the information that is clinically valuable, right? That they're the ones writing the check. But a lot of other people want to get a hold of that data as well. So, their CMS wants clinical data pretty badly. There are a lot of apps that want to get their hands on data, and it's not necessarily HIPAA controlled environments, right? So they want data that falls out of the HIPAA structure. Payers want data like immensely, right? So there's all these people who want all of this clinical data, but they're not the purchaser and they're not the user. And so policymakers sometimes can err on the side of we want to get access to all this information. We want it all to be shared like really, really broadly. And the person who's actually implementing it, who's using it, gets kind of stuck in the middle with workflows that are frustrating or that they don't even find valuable, that doesn't help them. And so that's something that I really hope we see addressed in the next couple of years. I'd say the last several years, we ended up with a bunch of certification requirements that didn't add tremendous value for our clients. Some did, clearly, but not all of them. I'd like to see us return a little bit more to thinking about that workflow, that clinician experience or their staff. What's their experience in using the software so they don't get frustrated and they're not overwhelmed and complaining about it? There could be other ways that we make that data, all of that useful, amazing health data, that we make that available to all of those other stakeholders who want it without having to frustrate the user. So I hope that can be a conversation that we can have, with CMS and ASTPO and C.
Last question for you before we wrap up here. What's one takeaway from our conversation today that you hope sticks with people the most?
I mean, I guess I would say, kind of that last point is we have to keep the user at the center of the conversation and not forget about them, and make sure that it's kind of a delightful experience to use the software. The more we have all of these development mandates from regulators, that takes our resources and it takes us away from responding to what our clients want. What do they want out of our product? What are they asking of us? And I'd love to get back to an environment, and this goes back a ways, before certification kind of dominated development resources. But, we want to get back to that. That's what we want. And we want to add the most value for patients ultimately, right? The more we can help our clients, the more they can provide fantastic care to patients. And that's ultimately, we all want that, right? As patients ourselves. So that's probably we have to keep our eye on that. Why are we doing this? And it needs to be about the patient.
I love it. I want to thank you once again for joining me on the podcast here today. We'll definitely stay in touch. I would love to have you maybe come on for a hot take or just a comment. When I know things are going to continue to change, there's going to be lots of updates. So appreciate having you in the loop.
I'm here.
Thanks so much.
All right. Thank you.